So thank you all so much for being here. I just have a quick like overview for our presentation for today, and then we will jump into hearing from our amazing speakers that are present. So um, we went through some introductions. I'm so thankful again that for you all to be able to be here. We're then going to have Kelly Martin share some about the Mid-Valley Suicide Prevention Coalition and the great work that they've been doing. I've received emails from the coalition because I hope to be able to attend a meeting one day, and so I'm able to stay on their email list and see all the awesome and really cool stuff that you all are doing on a regular basis. So I'm glad to be able to hear from you all. We're then going to hear from Angela Franklin on an update with like their Handle with Care program that's happening in Josephine County. Angela has talked about this program before, so I'm really excited to hear more about it. And then we're just going to have a quick legislative update as much as like we can in our new role, and just kind of an overview of what that advocacy and engagement work looks like for the Alliance as we move forward, and then just a brief overview of our upcoming meetings. We already did the introduction, so we won't need to do that. That slide is no longer needed. But before we get started with our speakers, I just wanted to, Annette always did like a grounding moment for us whenever we were coming into these spaces. And I think that that's just a really great practice to continue. So if folks are comfortable with it, go ahead and we can take a deep breath and then just look around your space and notice 5 things that you can see. You can either say them out loud or just to yourself. And then notice 4 things that you can touch. 3 things that you can hear. 2 things that you can smell. And maybe 1 thing that you can taste. Just to help us really get grounded in our space and in our time together today. Okay. So with that, I'm going to pass it over to Kelly to do our presentation. Kelly, did you want me to pull up slides for you?
Let's see if I can do
Okay.
it.
Okay.
No. Oh, wait there. Hold on. You never know. Technology and I are not the best of friends. So let's see. Oh, I think it's maybe gonna work. Maybe. It's thinking about it. Okay, there we are. All right. As I said at the beginning, my name's Kelly and I work with Marion County and I coordinate the mental health promotion and suicide prevention program. I've been with the county for about 23 years now, and but I have been doing mental health off and on, as like a lot of county people probably know, like sometimes your roles change, but for several years, and really took over the program around late 2020 to 2022. And what I do as part of my work is a lot of it is collaborating and coordinating the Mid-Valley Suicide Prevention Coalition with my partner, Abby Warren. So just a little bit about where we have been. So I think our journey with the coalition is Polk County started it in 2016. And this is a picture of Abby and I at one of our events. And our partnership began in 2019 between Marion and Polk County. So it became a collaborative between the two groups. And with anything, there's a lot of ebbs and flows. We've had a lot of staff turnover in this position in Marion County. And so that kind of, a lot of starts and stops. COVID hit, and that was like a hard stop. So around the end of 2022, we got some more consistency and we were able to really start digging into the work a little bit and gathering those partners. And we started to see a lot more growth. And currently, I think that things are going pretty well. I mean, there's always room for improvement, but we have some consistent meetings set. We have about 180 people on our coalition list, but about 25 to 30 that typically attend our meetings. So, and we have a lot of good engagement. So that's an exciting thing to see happening. The focus of the coalition has again evolved over time. When it first started, it was very much a training hub. They used to have contractors that we do trainings with and register everybody. But as more of our community partners started taking up training responsibilities, we were excited to be able to exchange our focus. So, one of our goals is that we really want to not have duplicate efforts. We want to leverage our resources and our community partners. So we moved into more of that coordinating of the resources, outreach, and education in our community, and how we can support our partners that are already doing some work out there. Um, One of the first things that we did was create a steering committee made up of the partners in our community. Different hospitals. We're very lucky to have Northwest Human Services in our community, which is the 988 answering service for around our area. And they have been a great partner. We did a SWOT analysis with the group to see what our strengths were as a coalition, our weaknesses, what are some opportunities that we could do, and maybe some challenges that we need to address, and then started creating an action plan for every year. So that kind of gives us a focus of where we're going to go. We started focusing on growing our coalition, making sure that we had representation from as many different groups as we could. And then our next step after that was we created a work group that we call the planning committee, but basically is actually the working group that we get together and really try to focus on our activities and what we're going to be doing. And just some kind of details like the nitty gritty. The main group has meetings quarterly, and then we rotate between counties because Marion and Polk are pretty big counties and so pretty spread out. So we try to rotate between the counties to make sure people have the opportunity to attend. There is also a virtual option for our meetings, but we always love to see people in person. Our steering committee meets twice a year to help kind of guide, and then also has access, during email during the middle of the year if we need anything. Our planning committee has traditionally just kind of met as needed. This year, we're trying something new that we're meeting monthly. And for some fun reason, we decided to do 8:30 on Mondays. I'm not quite sure why we did that, but that was our bad. But it's been going okay the last 2 months. We've had some good engagement. And we have a lot of different participants from schools, hospitals. We have the veteran groups here in our town, older adults, lots of CBOs and youth serving organizations. And as I mentioned, 988. So I just thought I'd share a few of the activities that we've been doing that are kind of our staples. We have some little projects that come up here and there, but during May, just like I'm sure a lot of you do, we focus on the signs of hope. We've been doing this since 2022, and we have grown it to expand to different groups. We try to get it out to all of the different regions throughout our whole counties. We added in some extra Spanish messages and some Russian signs because we do have some Russian speaking community members. And we really focus on trying to, again, do that social media piece of things so that we get the word out, not only on the, out where the signs are, but we're also highlighting our community partners and where they are at as well. So this is just a couple of our partners. We have some pharmacies, we have our first responders doing it, and we have our Northwest Human Services there, as well as a picture of our Board of Commissioners that we do a proclamation every May for Mental Health Awareness Month. Our tagline for our coalition is Life is Better with You Here. This again started in 2022, and we were going to try to do a different theme every year, but this has really caught on, and people have just really loved this theme. It's just, we get comments about it's very positive and uplifting, and we really have just continued this on. So we have posters highlighting 988. We have t-shirts you can see there, our tablecloth. And of course, we have some fun visitors that come to our tables when we're out doing events. We tend to do tabling events with different resources throughout the year, focusing with this message. Average, we do probably like 10 to 15 events throughout the year out in our community, at schools, at wherever we get requests for. So another kind of staple of what we do with our coalition is in September for Suicide Awareness Month. We do coffee sleeves that we purchase and distribute out to about 40 different local coffee shops in our communities in both Marion and Polk County. We have been getting about 30,000 coffee sleeves that go out. And this is, again, really been a fun adventure because we've been able to engage the businesses in this. You can see here the first two with the flowers and then the blue coffee sleeve. We ask our coffee shops to post on social media and tag us as well. So we're getting the message out to their customers as well as we share that and promote their business. Our coffee sleeve has, of course, our tagline, the 988 information, and it also has a QR code on the back that allows them to go to our website with more information and resources on there. The first couple years we did this, we also would do pop-up tabling events at the coffee shops to kind of support them. You'll see we had a special guest visitor, Caesar the No Drama Llama, at that Rosie's Coffee House there. So that was a huge hit. So if you have access to a llama, please, or dogs, please get those. We do work with Caesar a lot. He's his dad is very passionate about mental health, and we're really lucky that he gets to join us at different events. What we did last May is probably one of my favorite projects that we've worked on. We did some youth sensory kits, and Jen, it was so perfect that you did the 5, 4, 3, 2, 1 because the sensory kits really have been focusing on how can people use their five senses to regulate their nervous system and decrease stress and just self-regulate. This was something our coalition's been very passionate about. We created a work group, I think it was in January of 2024, and it was made up of youth serving organizations, providers, health educators, and we created the toolkit. So it has things on how you can use sound and taste and touch and smell to regulate your nervous system. The picture here on the left has the zippered bag and it has a journal. That was kind of our larger kit that we created, and that went out to mainly counselors or specific youth serving organizations so they could work with youth. Then we did do some smaller kits that were basically the same except for the zippered pouch and the journal because those are the more expensive things. And with the help of our coalition, we distributed about 2,600 of those kits out to, I think it was like 38 organizations. The pictures here are from our packing party that we did. We had about 30 of our coalition members that came throughout the day and actually helped to assemble these kits. We had a feel-good playlist that people sent in their music to going during the time. We had some food, and it was just a really great time. We've, in addition to the kits, we also put some educational resources on our website too. So it wasn't kind of a one and done thing. There was a lesson plan for teachers that they could use. There was the printables, so everybody could print these off or make their own toolkits with shopping links to make it really simple. And I still actually, a couple weeks ago, I was just talking to a school and she's like, I just used one of our kits yesterday on a kid that was struggling. And so because of all that positive feedback, we've continued spending our resources on providing these kits to our community and hopefully continue to do on with that. And then I mentioned at the beginning that we did talk about some different trainings that we've done. We, of course, promote all the Big River classes, but QPR tends to be the one that we are able to coordinate the best just because we have the more resources around that. We have a pool of trainers that are QPR certified that have volunteered to teach the trainings as needed. So community members or businesses or whoever is interested can request a QPR training on our coalition website. And then I send that out to our volunteers to see like who would be available to do the training. And then the coalition has purchased some booklets to be able to remove any cost barriers to this. And it took a year or so to get all the kinks worked out, but it's working pretty well now. Last month, we had a request for 5 consecutive QPR trainings from an employer, so they could get their whole staff trained in 1 week. And I sent this out to our trainers, and we had that filled within an hour. So we have some amazing, passionate community partners that I'm so grateful for. And then along with trainings, we've been doing some outreach to our first responders, promoting 988 and then also offering them QPR out there at their facilities. And we've have done 2 trainings so far, and we're still in the works with creating more. And then challenges, like we all have challenges, right? And it's probably the same challenges that all of you have. Not enough time, not enough money, and a lot of needs. So we've just tried to be really creative and focus on funding. I'm only 0.8, and Abby, I don't even think is that much. But again, we leverage our time and our resources with our community partners. We are very creative with any little mini grants that we can get with some different funding opportunities. And the high needs is we really try to use the data to look at where our pockets of higher needs areas are and focus on that. And it does kind of take more of a universal approach, like the 5 senses. It's like we're going out to everybody. We can't focus on very, very detailed things, but we do try to do more of a kind of a broad approach with that. And then the next steps. So last year we did a survey of our coalition, asking them where they wanted our group to go. And the couple things that came out is they wanted more engagement opportunities. So we are looking for ways to be able to have our coalition be more members be more involved. They wanted more trainings around mental health, like depression, anxiety, stress. And so we're again looking at that. We do a monthly or bi-monthly email that goes out, and that was another thing that the group really, really wanted to continue on with. So we let them know about other trainings that are coming up, highlight our community partners trainings that they're doing, as well as any other resources that might be helpful. We started engaging with our youth sports clubs this last year. This is a photo of our largest soccer club here in the area, and we were able to partner with them to purchase 6 large Life is Better With You Here signs with 988 on them, both in Spanish and English. And we're continuing our partnership with them. We're going to be doing a tabling event with our coalition members in April, and looking at doing social media and trainings with we are also doing some coaches trainings in April as well. So, and my goal is like, once we kind of get this going, is to expand to other sports teams as well. I'm always working on getting different groups represented at our coalition to make sure we get all the voices at the table. And then, as always, funding opportunities, looking for small grants, big grants all around. So that's always something that's on our mind. And then finally, just wanted to just remind you all that life is better with each of us here. We all bring something special to the table, and here's my contact information and our email. So if anybody has any questions, I'm happy to answer any.
I'm curious how it went connecting with the sports clubs, like with the youth sports clubs, like kind of what that outreach looked like. Did you already have some kind of ins with some of your members, like kids being in the clubs? Like what did that look like, being able to connect with them?
It kind of happened really organically. Like, I mean, my kiddos are in soccer, and then so we had a youth that is a ref at CFC, the Capital Football Club, and he connected me with one of the staff there who is very passionate about mental health. And we just started meeting with the lead there, and they were just like, yeah, let's do it. So we were like, let's go. So one of the things, and I say this to everybody because I'm always on the lookout for a good training. One of the biggest concerns that we've heard from them and several other sports clubs is that they need training and support for their refs. A lot of their referees are youth, like just teenagers, and parents and players can get very animated on the fields, and so they're needing some support, like how to help them deal with deal with difficult people. How do they deal with these emotions? And so we're looking for some different trainings to help support that. We actually had at CFC, they had a youth pass away from a medical issue this year, and we were able to support them and connect them with different resources. So just finding ways to support them, and they've been just really great to work with. So we're kind of lucky in that response.
Awesome. Thank you so much. Do folks have additional questions for Kelly about the Mid-Valley Coalition? I guess one other
I'll
question that
ask.
I have is really just kind of around like the spaces that are covered with. Do you know, is Yamhill going to be joining Mid-Valley? I feel like there's talks about that, but do you know if Yamhill is going to be?
We haven't had any talks about that for a while. So I think, yeah, I think we're just trying to get what we have going well, but we're, yeah, open to different ideas.
I just wanted to ask how the coffee sleeves were funded, because that's something we've thought about doing here in Tillamook.
Yeah, we have just pieced together different money. We've had some alliance grants. We've had there is a group here that does some work around suicide prevention that has been able to give us some money. We've with some different partners. They're actually remarkably inexpensive. I think for 30,000, it's like $2,200. So, that's helpful. But yeah, we've just, I, with the MHPP grant, I get a little bit of funding that we can access for that too.
Thank you.
Yeah, and also, oh, one other thing is check out your Rotaries. We've been presenting at the Rotaries, and ours just opened up like they just have small little grants that are like 500 to 4,000. So we just find these small little grants to help fund these projects.
Awesome. Thank you so much, Kelly.
Awesome, thank you.
Yeah. Angela, would you like to go to present next on Josephine County?
Yes. Let me get the thing. Okay. So everyone can see my presentation? Yeah. Okay. I'm talking today about a program that the Josephine County Suicide Prevention Coalition that we have been working on. And I'll give you the timeline later on, but we started working on this in June of 2022. So Handle with Care is a partnership between the City of Grants Pass, the police department, um, all of the other law enforcement agencies, the sheriff, the state police, the two different school districts, and then also our mental health organization, which houses the Suicide Prevention Coalition. So I'm going to go into kind of like why, and then I'll go into what the Handle with Care program is. So we all here probably know about childhood trauma and the ACEs, the adverse childhood experiences, and how that can affect our health and well-being throughout our lives. And we have different types of experiences around abuse, loss, chronic stress. And we know that the more children experience these different things, that this can affect later on more. And when we experience trauma, it can disrupt development and all of these different things that are going to increase suicide risk later in life as well. And so when it comes to schools, and that is who actually introduced this idea of the Handle with Care program, was a school principal. And so the schools know that the students who experience trauma and are not supported around those traumas, that they have decreased reading abilities, lower GPAs, higher rates of school absences, dropouts, and more suspensions and expulsions. And a lot of times we see traumatized kids with the greater reactivity, impulsivity, aggression, defiance, withdrawal, and also we see it showing as perfectionism as well. And so when a child experiences trauma, sometimes the next day in school, we are seeing kids falling asleep in class. Are they doing their homework? Are they failing tests? Are they just checked out? Are they having, outbursts in class? And really working to make our schools more trauma sensitive. So understanding that our behaviors and our kind of maybe challenging behaviors, that there's a reason why those things are happening. So that the idea of not what's wrong with you, but what happened to you is kind of what we're going towards. And so people are like, well, why is this a program within suicide prevention? And this is a very upstream suicide prevention approach. And so we're working to create trauma-informed and put that into action. And so Handle with Care is a program that started in West Virginia by the Children's Justice Task Force. And they recognized that there was a break in communication between what was happening in a child's home and community and when they were at school. And so they wanted to find a way to create a line of communication between what was happening in a student's life to be able to be more trauma informed within the schools without going into people's like privacy. So to still keep the different HIPAA and different privacy issues together. My brain is a little funky today. Sorry about that. So in 2011 is when this task force first started looking at doing some sort of programming. And then in 2012 is when they developed the Handle with Care program. 2013, they piloted it. And then in 2015, the West Virginia State Police launched it statewide. And so since 2019, 65 plus cities across the nation have launched Handle with Care programs. And so the Handle with Care program is something where the law enforcement agencies are giving local schools a heads up when they learn that a student has been exposed to a trauma. So the schools are not given any information about the event. They are just told that the student needs to be handled with care. So the notification, the only information that is in that notification is a student's name, their date of birth, and the phrase handle with care. And this is a workflow that we can look at. So it starts when an officer is called onto a scene, sees that a child has experienced a trauma. They gather information about what school that child or any other children that are.
Angela,
Yeah.
sorry to interrupt, but we're only seeing one slide in your PowerPoint, the
Really?
full PowerPoint window, and we've been stuck on slide 13. And since you're talking through a timeline, I'm wondering if you have that. Sorry to interrupt your flow.
It's not changing at all for you?
No, and we don't have the full
Wow.
screen version.
Okay. Then I am going to stop share. What slide are you looking at right now?
We're looking at 13.
Okay. then I'm gonna do, let me,
I've had something similar happen before. If you have like multiple screens, and you're
yeah,
sharing, you have to check to make sure it's sharing the exact screen. Otherwise, it'll just share.
yeah, I'm gonna move it over to another screen and, okay. Let me know. Oh, nope, stop share. I've never had this happen before, so this is,
That fun of the
yeah.
all updates that you get that they don't tell you how it's going to work.
Yeah. So are you seeing a flow chart?
Yes. Yeah.
Okay.
Thank
Is
you
this
so much.
the slide that I left on?
This is different from what we were seeing entirely, actually.
Oh
So
no.
thank you
Uh,
for letting me interrupt.
yeah, no, that is fine. So, I am, is this where you saw?
No, it was just on slide 13 that we're seeing. I wasn't sure. It was this one that we were on
Oh,
that time.
the entire time that I was talking. Wow. So, well, I'm just gonna kind of the handle with care. So, yeah, lots of different slides. So you'll get these in the email talking about ACEs and trauma and school leaders. Okay, so next day in school, upstream prevention. So you'll get everything that I said. Okay, sorry about that. So the Handle with Care program. So this is the flow chart where the officer on scene identifies children on scene and then gathers the information. They send an email to the designated school district personnel. The school district personnel forwards that to whatever building that child is going to school, so that then that administrator for the school building can inform the teaching staff. And that teaching staff provides classroom interventions, awareness, observation, support. And at that point, that might be all that is really needed to make sure that, we're being trauma sensitive. If not, then what happens is that there can be a referral to the school counselor, and then the school counselor will meet with the student and do an assessment or any other interventions. If that is not, if the person needs additional support, then that's when they can reach out to the family and see about getting some therapy with parental consent, and then continue with typical classroom activities. So there's different levels of support if needed. And a lot of these things already happen in the schools of the different levels of support, but really it's working on identifying the different types of traumas and letting the staff know that to be aware and that the different behaviors may be attached to something that the child has been experiencing at home. So the different types of incidents for Handle with Care notices. So trauma is not just a crime-related, thing. So it could be a traffic injury, a crash. It could be a house fire. It could be an eviction. It could also be, the arrest of a parent or a sibling, other family members that have experienced a drug overdose, any sort of sexual abuse or assault, acting out of sibling where law enforcement is required to respond. So like seeing someone within their family being restrained, by law enforcement. And so pretty much the trauma, we are training the police officers and the deputies if they are questioning whether or not something is traumatic, because it is, subjective, that we want to make sure that they go ahead and send in a notice. And I have a little bit of an extra story later on that I'll tell you around that. So what Handle with Care is, it is a notification system between law enforcement and the school district. It is a way that students exposed to potentially traumatic events to help identify those students. It ensures that the students exposed to trauma receive appropriate interventions. It supports the staff in managing difficult student behaviors that can stem from trauma, and it gives the staff the opportunity to get ahead of potential challenges in the classroom. We want them to be able to provide trauma-informed supports rather than punitive action against students. What it is not. So this is really important. So it's not something that is a rumor mill. So Handle with Care notifications only go to the designated school personnel. It is not an opportunity for staff to ask questions. We want to respect the students' right to privacy. It is not a guarantee that a mandatory report is going to be necessary. It does not mean that the child is unsafe at home. It is also not an invitation to rescue students. So staff focus on healthy support, like setting boundaries, empowering students to do what they can for themselves, and also recognizing when students need a break. So implementing this program, we found out that there was one other county in Oregon, Wasco County, that had this program implemented and was happening. There weren't any other counties in Oregon that had taken this on. And so we, for implementation, needed to have a minimum number of stakeholders. And so looking at schools, law enforcement, and mental health providers. So that was the minimum that we needed. We needed to get commitments from local leaders, like the superintendents and principals, the chief of police, and the sheriff, and then identifying liaisons and champions. So we had a few people that we designated in those different areas. And then also the Josephine County Suicide Prevention Coalition. So I was kind of the main person to kind of gather and provide ongoing assistance with this. So we met with the Wasco County Handle with Care folks, the Sheriff's Department, and a private school consultation person who did social emotional learning trainings for the school district up there. They were the ones who brought Handle with Care to Oregon. And so we met with them to find out what they needed to do, and then what were some bumps in the road or barriers that they had come up against over the few years. We also needed to figure out what implementation materials to utilize for the program, and then also how to monitor and review how it's going. So those are the things that we did. So we decided to collect data and so that we can review. So the school district keeps a spreadsheet, and it doesn't say a student's name on it. Every student has a student ID, so that way we can keep it private. So it just has the student ID number, the notice date, the student's grade, and the student's school. So we also have the different school administrators, the principal typically, or the assistant principal, they keep a spreadsheet, and they keep a spreadsheet again of the student ID, which teachers were notified, and if there was any sort of referrals to a higher level of support for that student. And so this is what we decided, like, we're going to work towards. So if we can do this to kind of evaluate how the program is going, then we'd be able to figure out what we needed to shift. So we also, this has not happened yet, and I'll tell you, but we're hoping that the teachers will be able to do some gathering of information from teachers to see how they're feeling about the program. So asking them how many students were identified as needing the support, like what were the changes that they noticed in students after they were identified, what steps were provided, what resources were used to address the students' needs, and what would help meet the needs of the students that they do not have for the Handle with Care support. So this is a timeline of the program. So the initial idea, like I said, came from a principal of one of our rural school districts who was a member of our Suicide Prevention Coalition. He has moved on to another position since, but he was a very important member of the coalition for a long time. And so the initial request was because we have this lack of communication between law enforcement and schools. We also, in our coalition, have talked a lot about the lack of information and communication between hospitals and schools. So those were the two identified barriers that were happening in our county. And so we found that we might be able to address the law enforcement communication, but the hospital communication we're still kind of working on that. And so then in August of that same year is when we brought all of those people together, and we had a meeting, and we talked about how it was going in Wasco. The law enforcement folks all met with the sheriff deputy from Wasco, which was really great, because when I found that the law enforcement, the culture, they were way more kind of open and excited to talk to another law enforcement agency that was doing this. So that was really great that we were able to bring that deputy in. And one of the things that the Wasco deputy told us is that, so timeline of implementing this program in Wasco, it took them 2 years to get the MOU. So an MOU is a memorandum of understanding, and it's a document, it's an agreement that all of the stakeholders in a program sign on to. And usually it's the highest level of folks within an organization or an agency. So we had the highest person in the sheriffs in our county, the highest person in our police, our executive director of our mental health organization. So that deputy was like, it took us 2 years just to get the MOU like signed by all of these different people. And then as soon as that happened, then they were off. So with us, we were expecting that same thing. And we actually got the MOU signed February of the next year. So that was like less than 6 months from when we first met. So we were all really excited of like, wow, this is going to happen a lot faster than we thought. And then in April, after the MOU was completed, we had kind of guidelines, and we pulled together a Handle with Care work group within the Suicide Prevention Coalition. and we started working on implementation and developing that. So that meant like, slide presentations, some one-pagers to give to staff and law enforcement, creating that email distribution, that an email address for each school district, so that that one address would be easy for the law enforcement to utilize. So then after all of that, August of 2023, we officially launched the Handle with Care program. And we, at that point, the school district, higher level folks, were the ones who took on the responsibility to implement this within their staff. And so they, were committed to bringing it to the staff and making sure that everyone was informed about the program. And then also the police department for the metro area, the school resource officer within our metro Grants Pass school district. He took the implementation materials and did the trainings for the police department. And then our sheriff's department also got that materials and were set to train their sheriff's deputies. And so pretty much at that point, we were ready to go. So then in March of 2024 is when, after a few check-ins, like every couple of months, I would check in with the schools and, see how the notifications were going. And it became apparent that the police department in the metro area was sending in notifications. But we realized that the sheriff's department was not sending in notifications. And so our bumps in the road that we identified was largely our sheriff's department is very understaffed. So Josephine County is a rural county, and the police department, in rural counties, the police are only in the cities. So everything outside of the city limits is the sheriff's department. And so that's a massive area for the sheriffs to kind of have eyes on. So we realized that we did not have full participation of our law enforcement agencies, and that there had not been trainings that took place for the sheriff's deputies. So a program like this largely depends on the buy-in and the participation of not only like the higher level people within these organizations, but we need to make sure that we get it brought down to the other levels. And so after meeting with our rural school resource officer, and he's a sheriff's deputy, and he is in charge of over 7 schools. So one school resource officer for 7 schools. And so that seems like a lot of schools for one officer to kind of develop relationships within. But he gave me a lot of insight into this program and what it meant for him as a law enforcement person. And it was really good to hear that insight, because he opened up about the fact that it is very hard for him to hear that the trauma that kids are experiencing, that it is so large and so broad. And he was like, and I feel like I myself at any scene is traumatic for a child. So it was really interesting to have a law enforcement kind of be aware of the trauma of just what law enforcement can be to children. So it was, it showed a little bit that the barrier might not just be the lack of education around what the program is, but also the hesitancy of kind of accepting and acknowledging that almost any interaction that the law enforcement was having with children on scene could possibly be traumatic. So it was just like, yeah, it was very insightful. So what he helped me, he helped be a liaison within the sheriff's department and really helped me figure out how to exactly train all of the deputies. And so just maybe 3 weeks ago, we nailed down trainings for all of the sheriffs. And so what it really is taking is me or someone outside of the sheriff's department to go in and train. So it's one of those hesitancy things of I kind of was thinking like, it's hard to just give someone else, a training and just hope that they do it. And that kind of is what happened, is that it did not happen. And so after March, when we complete all of the different trainings, we'll go at evaluation again. So we'll start checking in and see how it's going, because the majority of our law enforcement calls are from the sheriff. So we really, really need the sheriff deputies to participate if this is going to be a successful program. And then also making sure that we do school refresher trainings, because we have such turnover, and we just want to keep people aware of what this is and what this is not. Because sometimes, it could be a slippery slope. So Handle with Care, this is from an organization, Salud, which does handle with care assistance for organizations. And this is, I think this is maybe a year old, so it's probably even more growing. But the yellow are the interested counties. The purple is in the development phase, so you can see us down here. And the active ones. So the blue are the active Handle with Care programs across the country. Okay, so I will try to answer any questions from folks. I'm going to stop sharing.
Thank you so much, Angela. I really am glad that we were able to get an update from you. I know that we had a presentation on it earlier in the process, and so I'm really just thank you so much for coming back and talking more about it. I was curious with as far as like the barriers when it comes to the law enforcement, are there any common themes that you've heard with, like, I don't know if concerns or pushback, I can't think of the right word, but just like any kind of commonalities from any law enforcement departments around, yeah, any like concerns or things like that if they're hesitant to engage with this program?
No hesitancy except for the one deputy, who just opened up and said, this feels kind of makes me feel bad, knowing that I am a source of trauma. So he also felt like this program might create, maybe mend some relationships also between law enforcement and students. But I will be able to update you more on that after the training of the sheriff's department.
Awesome. Thank you. And I think another question that I have with this is, I guess, similar to what I asked Kelly about kind of interacting with the sports clubs, what did kind of outreach to the different departments, like, or the sheriff's department that you're going to be training with look like, and how did that kind of go about? Did you have an in already, like Kelly was talking about with her child already kind of being on a soccer team? Or
So we have participation from law enforcement at our Suicide Prevention Coalition. So we have the undersheriff who is present. So, and we also have a liaison from the police department. So because those two were kind of in the very early even discussion stages, they were able to be utilized to like get into the law enforcement. And because of both of them, they were able to help reach out to the Oregon State Police. Because since we're rural, we have we have the Redwood Highway that goes down through our county and is a major like thoroughfare. So we have a lot of state police presence in the rural area also. Did I answer your question?
yes, you did. Thank you so
Okay.
much. And Amanda put in the chat that they're hoping to be able to start this out in Tillamook. And so I guess too, like if there are other areas of the state that are interested in starting this out or kind of in starting this out in their area, would it be okay to point them in your direction, or is there a different spot that we should kind of direct them to?
I think that that would be good. And then also getting an update and connected with Wasco County and figuring out who are the other counties that are interested that, from the Salud map. So, and we are not officially supported by Salud beyond just utilizing their implementation materials and kind of adapting them. So that might be, I'm not sure what that process looks like to be officially involved with Salud.
Awesome. Thank you. Do folks have
Yeah.
other questions, or Amanda, is there anything else that you want to kind of ask as follow-up with hope of implementing this in Tillamook?
No, I just think that, we also have, schools on our coalition. We've got our local Tillamook PD involved, and they were all very interested at our Connect training. I think the sheriff will also be, a potential bump in the road. We've got 3 districts in our county, and I think our South County district also, they're kind of in crisis. But I think we're at that starting point to start having those conversations. And me being on the school board is also a great way to start introducing it to our biggest district here. So it was great for me to hear this again this week and remind me and get those contexts. And now I can start carrying that forward as we continue to do our postvention work and start bringing this in as part of our prevention.
Any other questions for Angela today? I do have one question for the group about for the Handle with Care program. The new 5-year Youth Suicide Intervention and Prevention Plan, our new YSIP, is started to kind of be created with new or continue different focus areas and like initiatives and stuff of just where we want to continue or start some new things or put pause on other areas. And I get one question that I have is, you could ponder this, you don't have to have a response today, but with this Handle with Care program idea and seeing how it seemed like it was pretty on that map, like pretty widespread on the East Coast. And it seemed like all of West Virginia implements it, which is fantastic that a whole state does it. But do you think that this type of program, we should have an initiative around that in the new YSIP? So that's just kind of something to maybe think about if that's something that we should recommend to OHA. Like, what are your thoughts about that?
Yeah, I think that it's good. I also want to hear people's concerns around this, because I think that Oregon, we lead the way in doing things in more trauma-informed, thinking about, like systemic racism and different things. So I would love to really bring together people to talk about like what are the possible things that we need to be aware of as well. So yeah, and I'm very open to hearing people's possible critiques. Yeah. And I think that anytime we bring in law enforcement, it definitely is going to sit differently with different folks, especially within our BIPOC community, I feel. And this came from West Virginia, from a largely from the Black community. So I'm curious of what those different responses have been from the East Coast folks. Yeah.
Awesome. Thank you so much, Angela. Those are all, yeah, just really kind of good points to think about. And I think too, just even as far as kind of like feedback around it and what you're kind of thinking, just with hearing any concerns about it, I wonder if it would even make sense. I think we may have talked about this before, but if this is something that people think could be a helpful initiative to recommend to OHA, and kind of hearing those concerns, potentially bringing it to a future quarterly and kind of also talking about it there, and then seeing what the larger alliance kind of thinks about it. But yeah, I think that this is, and there's a lot of really good feedback in the chat as well about the program. And I think last time that you had also talked about it, people were really interested and engaged with the idea. So I think that it's fantastic. So thank you so much, Angela, and thank you, Kelly, for sharing today. Okay. Awesome. Well, then in our last little bit of time together, I will I know I had put on our agenda that we would have just a little bit of a legislative update, and part of that was to really kind of talk through our scope within the alliance and what that looks like. And as you may know, there were some bylaw changes that happened over this last fiscal year that has just altered how we can engage with legislation and with advocacy work. And I think that it's important to be able to know that like alliance members and affiliates can still do the work. Like you can still testify on things, you can still talk with our legislators and do the things. It's just kind of how it's done has shifted. And so Chris and I came up with this handout. This isn't official yet. It has to be reviewed and then approved by our executive before we can fully share it out. But I just wanted to share this draft here today, as we are currently in the 2025 long session. So in case there was any piece of legislation that you wanted to talk about or testify on, you can have some ideas for what that could look like as far as like your engagement with the alliance. So before, we were able to, when doing testimony, staff and members were able to say things like, I'm here representing the alliance on this issue, and I think that you should or shouldn't support this piece of legislation. But because the alliance is an advisory group to OHA, we are not able, as staff and as members, we're not able to say that we are in support or in opposition to any legislation. So instead we could say like, my name is like Jen, and I'm part of, here's some different organizations, as somebody with lived experience or whatever it is that your connection is to lived experience work, just to be able to be more not as like pinpointy about like the alliance and as a member, but more kind of just saying this is somewhere where I am using my experience and my connection to suicide prevention work. And then just at a quick glance, our OHA team folks, they're the ones who really develop that policy option package with taking into consideration recommendations that advisory groups like the Alliance send to them. They also track legislation. They can't directly support or oppose legislation, and they also can't provide testimony as a staff member. And then our Alliance staff, what we see our role now as far as legislation goes is really kind of in an educator role. So like we can create educational materials for legislators. We can advise OHA on policy priorities and recommendations, and we can also track different legislation on our end just to see what we think might impact our world of suicide prevention in a positive or potentially negative way. And then just like OHA, we cannot support or oppose specific legislation. Whereas you folks as Alliance members and affiliates, you can reference the Alliance and legislative testimony, but you just really can't say that you're there on behalf of the Alliance or that you're representing the Alliance. So those are just some quick just a quick overview of what that shift looks like in some of our language and our verbiage that we have to have moving forward when it comes to testimony and just doing some of that legislative work. And again, once this is finalized and approved by the executive, I'll be able to fully share it out. The last piece that I wanted to look at, just to show you all really quickly today, is really just kind of what a timeline may look like for getting those recommendations to OHA. Like I said, we're currently in our long session for 2025, and OHA really plans things out a little over a year in advance. So in order for stuff to be on their radar, excuse me just a second. In order for stuff to be on their radar, like for the upcoming long session, like for 2027, we really have to get them things by like September, October of this calendar year. So about a year and a half before the long session starts is when we have to send in our recommendations to OHA, because that's when they start to talk about their policy option packages and also just their legislative priorities for the next time around. So this is going to be a focus area for us as an alliance over the next handful of months, just to be able to receive recommendations from our alliance folks and then get those finalized and sent over to OHA. So that is just a quick update on what things could look like as far as engagement or advocacy work looks from the alliance perspective. Do folks have any questions or comments or concerns at all around it about any of this, or areas for clarification? So again, that will be reviewed by our exec this upcoming Monday, March 3rd is when we have our upcoming meeting. And then if they approve it, it will go to it'll be sent out to the full alliance, and also just kind of an overview will be provided during our March quarterly as well, just so that way folks can see it, but it'll be shared after that. And then the other thing, this will be sent out to the full after today is just an upcoming look at our meetings for this upcoming fiscal. So this has just when all of our different subcommittees are going to be meeting. There are some holidays on here. Like for example, I think there was one of these committees falls on a holiday, I think. So like those ones will have to be like shifted, but for the most part, this will be when our different subcommittees meet over the next fiscal, as well as our full alliance quarterlies and the webinars that we have. And so this will be sent out, and the hot links, or the links that are on here, are where you can go to register for the different quarterlies and webinars, as well as also have more information about the subcommittees if you want to learn more about them. So this will go out to everybody too. Any questions that people have about any of that? No? Okay. Awesome. Well, that's our webinar for today. Does anybody else have anything that they'd like to share? Any announcements or any updates that you all think is important to kind of share with folks today? Okay, awesome. Well, thank you all so much for your time. I really appreciate you being here and just for being engaged in this work. And I look forward to continue working with you all. I hope that you all have a great rest of your day.